Hello, I'm Suzanne James, and this is Nightshift, the podcast where we talk all things voluntary assisted dying in Australia. Very pleased to be joined today by my good friend and fellow advocate and President of Dying With Dignity New South Wales, Penny Hackett. Penny Hackett, welcome.
Oh, whoa, very pleased to be here.
Give us your organisational update, will you? What you and the board have been up to, any recruitment or fundraising or other initiatives that you wrapped up last year?
Obviously, monitoring VAD implementation and now the operation and trying to keep our finger on the pulse. But the thing that was been taking up most of our time is our witnessing program, where we train volunteers who will assist people who are applying for VAD with their written declaration. It requires two eligible witnesses, and the eligibility criteria are quite strict. So even fairly distant family members can't act, and a surprising number of people find it difficult to find someone, or they feel uncomfortable asking a friend or a neighbour to act in that role. So we've now trained maybe 220 volunteers, and we've witnessed maybe 270 VAD declaration. We're getting increasing requests from New South Wales Health. And what we found through that program, it's just been an invaluable way to build relationships with the care navigator teams and the practitioners in the local health districts. So it's sort of killing two birds with one stone. It's been really helpful for VAD applicants, but for us as a relationship building and a data gathering exercise, it's been absolutely wonderful. We are continuing to try and raise awareness about VAD and also end of life planning, because the best thing that can happen for everyone is that we talk about death and dying and we express our wishes, whatever those wishes are, and put them down in writing in advance care directives and appoint substitute decision makers. So we've done quite a lot of talks to a whole range of groups, a number of U3A, University of the Third Age groups, some Rotary groups, a couple of little conferences and various community groups. And we're really keen to try and build a pool of people who are able to and interested in helping give similar talks in different places. We can cover Sydney quite well, and we've got some people in Newcastle and a couple of other spots, but we find that the best way to communicate and get people talking about death and dying is at the grassroots level and people in their communities talking to their local network. We haven't formalised a speaker training program yet, but that's definitely on the agenda. So we've now got something like 54,000 people on our database,
Wow.
and that's something that we continue to certainly maintain and try and build where possible, because when we need to get up on our hind legs and campaign again at short notice, as happened last year, we can immediately call on this wonderful pool of incredibly motivated people to write to MPs and complete surveys and tell us their stories. The current work right now is getting ready for this legislative review.
Explain to the uninitiated, if you will, Penny, why this review is occurring, who will be conducting it, and how people can have input into that review.
So each of the VAD laws, which has been was passed before us, they had a provision in there for a review of the law after a certain period. In Victoria, it was 5 years. New South Wales, they put 2 years in, which actually I think is a little bit short. It's a review into the operation of the current law. It's not really intended to look at whether there's any opportunity or need for further legislative reform or an expansion of the current laws. That said, we know that there are some issues which really do need to be fixed to make it operate a little bit better. And then there are a number of areas where we are absolutely aware that the community would like the laws to be broadened. So we will be raising those points, but we are going to draw on our day-to-day experience and the personal stories of how the current law is operating and see where we can make suggestions to change, sometimes the protocols. There might be some things in the clinical guidelines and the process and the portal and the way that doctors are required to deal with requests, and also issues of conscientious objection that we're going to make really quite strong recommendations about. And then we also will raise the issues that are constantly raised with us about potential expansions to the law to make it more available for people that have suffering, which is what it's all about. Telehealth would make quite a big difference to the cost of delivering VAD, because in New South Wales, to get around it, they will often have to fly someone out to very remote locations because they've made a commitment to equitable access across the state. Now, some of those things have nothing to do with the clinical assessment. They're just discussing logistics about how to make an appointment to meet the pharmacist, that sort of thing. It's ridiculous. And the major suicide groups have put out a joint statement to say that VAD is not suicide. And really that should be sufficient. You've got the AMA on side. So we'll have to just keep pushing away at that. It's inexplicable. And in some ways it's really a denial of states' rights, because all the states have passed this law and they're being obstructed in its full execution by a piece of Commonwealth legislation that was not intended to cover this issue.
And you have a survey you put out last night to your supporters asking them for input to that. Tell us a bit more about that, Penny.
Review is done by the Ministry of Health, and they've contacted a number of interested parties, being unions, elder groups, advocacy groups like ours. So we had a very, very frank and encouraging discussion with Kerry Chant about it. She's been handling these groups herself, which is very pleasing to see. And it's, we've said on a number of occasions that we've been really, really happy with the approach that New South Wales Health have taken. So they are running this engagement process, and our the submissions are due at the end of February. One of the things that we felt was that we wanted to collate the views of our very substantial supporter base, but that it would not be ideal to have all of those individuals lodging their own submission. So we decided to do a survey to cover off the things that we could encapsulate in our submission to support some of the points that we're making. And so far hasn't even been up for 24 hours yet, and I think we've had about 1,600 responses.
Wow.
A lot of the results that I've sort of skimmed through in the analytics are consistent with what we expected them to be. So you might say we know our supporter base fairly well, and that's because they contact us often and tell us what they think, which is fantastic. So it also enables us to contact people that have made certain specific comments, or they have a personal experience with VAD. And for those that have knowledge to be able to give an informed submission, personal submission, we are going to ask them if they can do their own proposal, because we want personal stories are the best way to illustrate the good things and the bad things and the experiences of the families. So our aim is to be able to speak for our supporters without blowing up the portal at the ministry. Yeah. So once they've done the public consultation, they're not doing any sort of public inquiries or anything, but after that they will prepare a report for the minister, which I understand has to be done by the end of June, to Brian Park, and then he has to respond and then table the report and his response in Parliament by the last sitting day of this year.
Right. Well, that's a fantastic start to get that sort of response. Now, we know how well supported VAD is in the community. The other impact of that is a steady increase in numbers, in uptake, as people become more aware of it and clinicians become more comfortable discussing it. So, where are Dying with Dignity New South Wales at with all that, Penny, in terms of lobbying for more resources and what's needed?
Well, we are in a quite a different position to states like Victoria because virtually all of the VAD is being organised and delivered through New South Wales Health. So in Victoria, they don't have local health districts. They have hospital boards and areas. So there's a lot more different decision makers having making executives making decisions about what they are and aren't going to do. Whereas in New South Wales, there are 15 local health districts. At implementation, it was determined that every one of those health districts had to have their own VAD team and implement an arrangement so that it could be delivered in their LHD at no cost to the patients. So pretty much all of the practitioners are either New South Wales Health salaried doctors or they have arrangements with a lot of GPs, but some specialists, to be contracted as what they call visiting medical officers or VMOs. So those doctors get paid for their time, including the ones that are on what they describe as the flying squad, which is the remote access team who will go if there's no one available or no ability to provide someone in that LHD. The flying squad will literally go to Brewarrina and Mildura to do the assessments. So in terms of building the VAD workforce, it will be the case that they'll have to keep refreshing the workforce to ensure that people don't get burnt out, because even though the practitioners we've spoken to are finding it incredibly rewarding work, it is still quite difficult work. So they need to share that burden around a bit. And also, you're right, the numbers are going up, and that's going to be, I think, the main challenge for delivery of the system. I know there's a couple of LHDs where the VAD navigators are really under the pump.
I'd like to wrap up by talking about what happened late last year, which was the Carter Bill, where the religious-based institutions, which to all intents and purposes are corporations, want to plead conscientious objection and disallow their paying customers from accessing legal healthcare, voluntary assisted dying in their residential aged care facility. Talk us through how that blindsided everybody, Penny, and I'm glad to say that we got it defeated, but the vote wasn't nearly as wide as it should have been, yeah?
Yeah, I've got to say we weren't expecting that a religious assault on the VAD laws would be focusing on our elderly, incredibly vulnerable people in aged care, many of whom have absolutely no choice over where they end up in aged care, even if they can get a spot in aged care at all. So this is going to be an ongoing and expanding issue, I think, not just in VAD, but it covers abortion and gender care and contraception, and which is this right of an organisation to conscientiously object. So it's well understood, and I think fairly uncontroversial, that individual practitioners and healthcare workers should have the right to object to certain things that don't conform with their religious or other beliefs. But when it comes to a large organisation making a blanket rule that they will or won't provide certain legal health care, they're either paid for by the person or paid for by taxpayer funds. And in a number of instances, what I only realised a year or so ago was that the Catholic Church runs something like 23 or 27 public hospitals in Australia. So a lot of us in Sydney are familiar with St Vincent's, which has Vincent's Private and St Vincent's Public. But there are a number of others across the country where if you happen to be in the catchment for that public hospital and you want to have your tubes tied after a cesarean or you're having an ectopic pregnancy, it's something which I think the religious opponents have accepted that they're not going to be able to get rid of VAD entirely, but they're making a big thing about the moral hazard to staff of having VAD in aged care. So under our legislation, a private hospital or a hospice can refuse VAD on site. Aged care facilities are in a different category because under the aged care legislation, that is a person's home. And so the requirement is that the facilities don't need to participate themselves and they can prevent their staff from having anything to do with it, but they must allow the external care navigators and the VAD practitioners to come in, do the assessments and do the administration. So I get back from a very nice holiday in October last year, and all of a sudden there's a bill put before New South Wales Parliament to basically remove that obligation on aged care providers. And it was done deliberately as a short, sharp, let's get it through. It was in the upper house, and it was almost a case of being tabled one week, debated and passed the next. So fortunately, everyone rallied. We had wonderful support from the Greens and legalised cannabis. We managed to get two very senior lawyers to give an opinion to say that the bill was actually unconstitutional because it was in conflict with the Federal Aged Care Act. But it was just so distressing that there would be MPs who were so callous about the position of people in aged care and refusing to accept what everyone knows, which is that it can be impossible, like you said, particularly in regional areas. You can't just go, oh, I'll go to the corporate aged care in my tiny regional town, when the only aged care that may be available for miles around may well be a Catholic provider. So you can't just get up and head outside or go off to another facility to have a VAD consultation. There are stories from Canada where this is raging, this institutional conscientious objection, stories of people in hospices being wheeled out of the hospice to have a VAD consultation in a bus shelter.
That's just outrageous. The thing that really got up my nose about the whole thing with the Carter bill late last year, Penny, was that Susan Carter, the Liberal MLC that tried to ram this thing through, had the hide to stand up in Parliament and say, I quote, they can simply, unquote, transfer to another facility. Now, even if that facility was readily available, anyone who's ever genuinely looked after someone who's suffering from a terminal illness, especially near the end of their life, would know just how cruel and outrageous and counterproductive and clinically wrong that suggestion is.
Yeah, it was the callousness of it. In some ways, to be honest, found it almost more distressing than some of the absolute rubbish that was put forward when we were in the actual VAD debate to get the laws passed in 2021 and 22. Like we knew what was coming out there, but I really did not expect them to be so casually dismissive of the position of elderly people in aged care. Maybe 30 years ago, the people that were in aged care were not nearly as sick as they are today. By the time a person needs to go into aged care, they are often in an absolutely diabolical state. And it's just so unfair to be using them as a political/religious ping pong ball, either score political points or appease some ideology, which is then impacting on the healthcare and the living circumstances of people that have no connection with that faith or belief.
It's a very small, over-influential group that are involved in the upper echelons of politics and the church hierarchy that keep pushing this line. The vast majority of Australians in all state and territories very much support people's right to personal choice for VAD. Maybe governments need to grow a spine and start standing up to the church lobby a bit harder and remind everybody that this is a democracy, not a theocracy. And if you want to accept public funding, then you have to accept the mandate to provide publicly, legally available services. Penny, it's been terrific to catch up with you today. Thank you so much.
Oh, thank you. Always happy to talk. And hopefully this review will bear some fruit in terms of, at the very least, fine-tuning some of the things that could iron out a few issues that might streamline and make things a bit more accessible.
You've been listening to Penny Hackett, President of Dying With Dignity New South Wales, talking about the upcoming review of the operation of VAD in New South Wales. I'm Suzanne James. Thank you for joining us on Nightshift.